that's allegedly derived from and glamorizes the appearance of someone who's strung out on heroin.
Images projected in fashion photos in the last few years have made heroin addiction seem glamorous and sexy and cool. And as some of the people in those images start to die now, it's become obvious that that is not true.
Heroin chic is making a comeback. I mean, it's like bell bottoms made a comeback, but they kind of don't do the bell bottom. It's like all wide, all big. The same thing. It's called skinny obese. There's a couple of ways to get to it. Yo-yo diets, genetically, meaning if you're Asian or Indian, you could have it genetically. So that's one you need to watch for. And the other ways are with the new designer drugs for diabetes and weight loss. Ozempic and Mounjaro, and versions of their different names, same drug. GLP-1 and GIP antagonists. So why is this so dangerous? Well, it's dangerous for a couple of reasons. One, it's hard to detect. You look really nice in clothes. No one can complain. No one can say anything. You look good in clothes, right? Physicians can't diagnose it with their eye. They can't measure your circumference, which is what they do a lot of times, and say, oh yeah, you got central obesity, we need to do something about it now, because your circumference is going to be good. They'll do a BMI, and basically your height, your weight, and you'll fall in the perfect range. But what they don't see, the MRI sees, or DEXA scan, and that is that you have more fat than muscle. That proportion of fat to muscle is off. And this is the danger. And the reason it can be off like this is because, one, muscle weighs more than fat. So imagine this, you have very little muscle mass, but you have it covered with fat. You have internal organs covered with fat internally. So in the end, your net weight is the same as someone that's lean with, with muscle that basically looks like you. So another version of this is called TOFI. TOFI is a person that looks like he has a healthy weight, but has a lot of visceral fat, a lot of organ fat hidden within. So both of these give you the skinny obese phenotype, okay? External visual phenotype. The problem here is severe. Why? Because basically you have the same problems as an obese person, only worse, because you lack any muscle mass. And we're going to see how important muscle is. So lack of muscle can mean breathing problems, cardiovascular risks, obesity-related issues, falls and fractures, insulin resistance, cardiovascular disease, muscle fiber changes, atrophy, loss, degeneration of protein synthesis breakdown cycle, changes in hormones and growth factors, mitochondrial dysfunction. Remember mitochondria with Ross? Okay, oxidative damage. Mitochondria is like the engine of our cells. Inflammation, something we don't want to have. Changes in satellite cells, cellular senescence, neuromuscular changes, fat and fibrotic infiltration, mental health issues. People in long-term care will have really a hard time recovering. In the ICU, issues, surgery issues, post-surgery, more risk for cancer, COPD. With trauma, you're going to heal much less, quicker. Everything breaks down without muscle mass. And this is where you're going when you have the skinny fat phenotype. So you have the whole mess of obesity, meaning you get a stroke, you get heart disease, mental decline, plus with the muscle mass declining, on top of that, you're getting a whole other plethora of problems. So this is kind of worst, because really we need our muscle mass after 35 starts going down. So we lose muscle, right, as we age. This is the main aging component, okay? If you want longevity, you gotta have muscle. You gotta keep your muscle mass. If you start losing this early, it's gonna be a problem. It's gonna be a big problem later on. And we lose this by, one, doing yo-yo diets, dropping the weight quick, but even more so when we use stuff like Ozempic and Mounjaro. That's when it really drops. We're looking at about almost 50% of muscle loss when we lose the weight. That is ginormous. I mean, if we do it naturally, if we're just losing weight, at worst, we're looking at the 30-something percentile, and that's bad. That means you're doing it bad, you're doing it too quick, whatever. This pushes it up to nearly 50%. Muscle that's very hard to get back. The TOFI MRI. So here we can see similar age, gender, BMI, same percentage body fat, except this is TOFI. You'll see that on the left you have way more fat, and that's the white area, the lighter area, way more fat, almost 5.9 liters of internal fat compared to 1.7 liters of internal fat on the right. And these subjects are defined as TOFI, have been described as being at higher risk for developing insulin resistance and type 2 diabetes due to the fact that they have reduced physical activity, VO2 max down, reduced insulin sensitivity, higher abdominal adiposity, and a more atherogenic lipid profile. Another important characteristic observed in this cohort is elevated levels of liver fat, NASH. So this is ridiculous. I mean, it's a overconsumption of fructose that can lead to this. It induces inflammation through the body, which we know is horrible, is horrendous. So this is an example of TOFI, and it's not someone that's super thin. It's someone that, but you know, on the right you have the person that's normal, looks exactly like the one on the left, same measurement, same everything as for your doctor's eyes, but is on a road to sure death by stroke, heart attack, diabetes, you name it, any disease. So this is the danger. This is the danger. Next, we're going to look at a variation in visceral fat content. Okay, so what I want you to see is, again, the white, and it's cut, like pretend they cut me in the middle, right here by my umbilical cord. They cut it through, and that's what you're seeing. You're seeing a plaque of that, right? Like this. So you're seeing it like this. My navel's at the front, my back's at the back, down, up and down. And when you look at the white, that's the fat. Okay? But all of these have the same circumference. Complete different fat levels, though, but same circumference. So when we're measuring circumference, guess what? We're not going to see it. We're not going to be able to see it. This is the problem physicians have, and this is the problem caretakers have. The studies indicate that proteins in muscle mass are used by the immune system to respond to injury. The underappreciated role of muscle in health and disease. The authors indicate that altered muscle metabolism plays a key role in the genesis and therefore the prevention of many common pathological conditions and chronic diseases. So I hope that I've been able to really drive the point home of how important muscle mass is. It's our glucose sink. Is where the glucose in our blood can move to, okay? A little bit in the liver, but before you know it, you got fatty liver disease, and most of it in the muscles. If you don't have muscles, it can't leave the bloodstream. And we go into diabetic. We go into diabetes. So really, this is extremely important. What happens when we take Wegovy, when we take Mounjaro? All right. Well, When the GLP-1 binds to specific receptors in the body, it triggers a series of mechanisms to regulate blood sugar levels, good, slow the movement of food through the digestive system, and act on neurons in the brain, all of which give people a feeling of fullness that helps them eat less and lose weight. Now, that's if you take Ozempic. If you take Mounjaro, you have a GIP and a GLP-1 agonist. So there's two mechanisms at work. That's why it works better for weight loss. Let me read you something of what is happening in this field. Last August, the pharmaceutical giant announced it had completed acquisition of Versanis Bio, the company that makes bimagrumab. According to Eli Lilly's statement, the drug was being tested alone and with semaglutide in overweight and obese people. And bimagrumab and related drugs were being considered for the use in combination with tirzepatide, which is, Mounjaro, and other gut hormones. Fellow drug makers are taking similar steps. Now, the reason they're using this is because they've seen that this drug increases muscle mass. And one of their huge problems with these two drugs, Ozempic, Mounjaro, and the derivatives thereof, is muscle loss, big muscle loss, driving you to be what? Yes, skinny obese. All right, so people are having trouble with it. So they are basically trying to look for a solution. So these are the pitfalls you got to watch out for. Now I know there's in the news they're saying, listen, there's new news coming out where they're looking at all the studies, all the people that have been on it, and they're studying the cases, and they're saying, okay, there might be a benefit to cognition. Both of these drugs, Ozempic and Mounjaro. So that's huge news. It has not been tested yet. I mean, no double-blind studies, but it's basically observational study. This is what they're seeing. So people are getting happy. Don't get too happy because, yes, when you're on it, this could be happening. Let's say it's true. Let's say this is happening. The problem is when you get off it, that's the problem. Cravings come back. Cravings change. Cravings get worse. You can regain your weight if you're not taught to eat right, not taught to do the right things. You can actually have more issues after you're done with it. So, yes, it is a problem. And again, you're not gaining back muscle mass. The muscle mass you lost. For every little bit of muscle mass, you're going to have to fight your way with resistance exercise to gain some of it back. This is what we have to understand. It is very hard to gain back, especially when you're older, especially after 40, after 50, it gets harder. So do we need to be more aware? Yes, we do. And that's why we do this. All right, so we can get aware. Listen, I'm going to continue, but please subscribe, ring the bell notification, invite friends. People need to know this, okay? No one's talking about this. According to a report in the Journal of Clinical Endocrinology and Metabolism, very low muscle mass is a risk factor for insulin resistance. And higher muscle mass relative to body size is associated with better insulin sensitivity or lower risk of pre or overt diabetes. Hey, frontiers of psychology. The anxiolytic effect of resistance exercise showed that muscle building exercise, specifically resistance training or strength training, has anxiety reducing effects. 2018 study in JAMA of Psychiatry found that people who had mild to moderate depression who performed resistance training 2 or more times a week saw a significant reduction in these symptoms. The Journal of Sports and Health Science, the author noted that exercise has an anti-inflammatory effect and habitual exercise improves immune regulation, delaying the onset of age-related dysfunction. The list goes on. The list goes on. This is why it's so dangerous to lose this muscle mass, to be skinny fat. It's dangerous, not only because we can't see it, it's very hard to detect unless we're doing MRIs or we're doing a DEXA scan or we have someone that really can see this, know this. It is extremely tough. But what do we do about it? What do we do about it? Okay, let's see. You obviously see where I'm going with this. Okay, so when you see these skinny obese people and they look good, they look fine. In clothes, they look perfect. Like they don't need anything. They're usually we're saying, "Oh my God, they're so fortunate. Look at them." They're no, no. They're and even if they're lean, even if they've been able to drop their fat down, they're only a fraction away from getting issues because even a little bit of fat increase will throw their balance off, muscle to fat balance off, where all of a sudden their body's acting like an obese person. So, what do we need to do? We need to build muscle. We need really to build muscle. And that means these people need to get off of running on the treadmill, get off of long aerobics, get off of any distance work. Anything you're going to do is going to be walking. And if you want to make it even more effective, walking with a vest, a weighted vest, 8 kilos, 10 kilo vest, boom, put it on, walk with that. You're going to be walking. That's it. No running. No, I don't want you to burn any muscle. I don't want you to your body to stop eating the muscle. All right. Secondly, you're going to do resistance training, meaning, and you're going to have to up the ante every week. Okay. Progressive. I mean, you're going to have to progressively get more weights, get more resistance, do more in the training because your body adapts and then we need to unadapt it. So we need to, as soon as it adapts, move it to the next level. That's how we're going to get growth. We really need to fight for this growth, okay? So weight training 3 times a week is a must, And I would suggest full body. So we got one, zone 2 walking, full body resistance training 3 times a week, minimum. Right? This is to start getting you. And then every week, upping the reps and upping the weight. All right? We need to get change in these muscles. And to bring change, we're going to have to work very hard. This is also going to help reabsorb the fat. The visceral fat, because we're really focused on, okay, how do we mobilize this fat? So we're doing everything to mobilize this fat and to use our energy from fat. The other thing we're going to have to do is up your protein intake. This is I don't even have to look at your diet. You need to up your protein intake. You need to up it to 2 to 2.2 grams of protein per kilogram of your ideal body weight, which is higher than your body weight now. So calculate it, like plus whatever pounds you need to be at to be healthy. Calculate that and then you need leucine, 2.5 grams with every meal. You need to have at least 3 to 4 meals. All right. If you can't get it through your stomach, and I know a lot of these people have issues with eating a lot and they eat so little and the protein is just going to be filling, I need you to do whey proteins. Get a good whey protein and do shakes in between. I need you to get that protein in. We need to have muscle protein synthesis. Otherwise, we're not going to build. We're going to keep tearing down the building. Right? We need good sleep. You need to have 7 hours of sleep. Quantity and quality needs to be good. If you have stress, go to my stress podcast. See how to deal with stress. Short-term, middle-term, long-term stress. With sleep, same thing. Go to the sleep podcast and see what you can do for sleep if that is one of the things that you're struggling with. And really get your food up, get your training up, and get back to the journey of health. You need to be healthy. You need to be healthy. And we want you not thin. We want you strong. And I don't mean bodybuilding strong. I mean just strong, healthy, strong immune system, strong health, ready for your aging challenges. Okay? So woman or man, get in there. Get rid of that fat. Get rid of that abdominal fat. Get rid of that liver fat. And start building some muscle, because muscle is going to keep you healthy in every sense of the word. It's probably the most important organ in our body. Thank you. Subscribe, ring the bell notification, invite friends, stay on this journey, and there's a lot more coming. I just really wanted to, with this one, it's close to my heart. The research I've done in obesity, chronic disease, all comes together here. And this is one of those hidden ones, one of those where no one thinks it's a problem. And it's probably the biggest problem. Not in terms of how many people, but in terms of severity. We really need to look at this one because this one goes unchecked and wreaks havoc. So thank you. Until next time, this is the Visceral Podcast.